As I've said before, COVID-19 vaccination is the most significant public health intervention of our time. And while we are only weeks into this monumental undertaking, incredible progress has been made. We hear stories from across the state from our Phase 1A healthcare workers and the residents and staff of our skilled nursing facilities expressing gratitude and relief when they receive their shots. And at the same time, we also know many of you are frustrated and feel that vaccine rollout is taking too long. We hear you, and we want to reassure you, everyone in Wisconsin who wants a vaccine will be able to get a vaccine, but it will take some time. We are currently still in Phase 1A, and we are working diligently to vaccinate our healthcare workers and the residents and staff of our skilled nursing facilities. That vaccination process is complex, and I know you have a lot of questions. So I want to walk you through the COVID-19 vaccine allocation, distribution, and administration process. So the first step in the process is that the federal government determines allocation based on our state population for the upcoming week. The next step is that DHS sends out a survey to registered vaccinators in Wisconsin. This is for us to determine each vaccinator's capacity for storage and for scheduling of vaccine clinics. For an example of how we are growing our capacity in Wisconsin for these eligible vaccinators, on December 14th, we had 108 eligible and enrolled providers that could vaccinate. As of January 5th, we have 1,066, full 10-fold increase over the last few weeks. So we now have that many more people who can answer the survey compared to just over 3 weeks ago. Based on the results of this survey, we allocate vaccine to each provider, and DHS sends the order into the federal government. The federal government receives the order and then ships vaccine, which can take a few days. For the Moderna vaccine, the vaccine is shipped directly to the vaccinating locations. For the Pfizer vaccine, due to the extreme cold storage, it is shipped to regional hospital hubs and then redistributed to clinics by our staff on the vaccination task force. This includes staff from Wisconsin Emergency Management, the Departments of Health Services, and the Department of Natural Resources, the Wisconsin National Guard, and the State Patrol. This is a great illustration of how we are working across state government to accomplish this amazing task. Once the vaccine is received, vaccinators schedule clinics and do the work of vaccinating, getting shots in arms. And then vaccinators update the Wisconsin Immunization Registry with data. From start to finish, this process typically takes between 7 and 10 days.